Hello and welcome to the first video on my new YouTube channel, Vet Nurse Rambling. I thought it would be really useful just to give you a brief summary of my history, how I became a vet nurse, and to also just give you a bit of clarification around how you can train to become a vet nurse. There are a couple of different ways of doing it, which obviously might suit different students, so I just thought it would be beneficial to go into that a little bit deeper. I also just want to explore the role of a vet nurse, just to give a bit of clarity around that, because I think it's definitely a misunderstood job. One of the most common questions I get asked is, when are you going to become a vet? Which we'll come on to. So I left school after doing my A-levels. I knew that I didn't want to go to university, and I had to think quite long and hard about what it was that I actually wanted to do. So I decided to do some work experience. I went to a veterinary practice for about a week or two, and within a couple of minutes of being there I was like, oh my god, I found my calling, this is where I belong. So I looked into the different ways that you could go into training to be a vet nurse and had to think quite long and hard about what was going to suit me best. I'm naturally quite an academic person, so a degree course probably would have suited me quite well, but I really didn't want to go to university, so I was keen to find out what my other options were. So just to clarify, obviously there's an honours degree course where you go to university, you do placements in practice so that you can put into practice the skills that you've learned whilst you're at uni, but it's very much a university experience, and that wasn't something that I was interested in. It wasn't something that I felt I needed to do, so I thought I would much prefer to do something where I was working and learning on the job. So that's what I ended up doing. It was very similar to an apprenticeship, so I would go to work for 4 days a week and then go to college for 1 day a week on what was called a day release course. It involved quite a lot of distance learning, so they condensed the course down from 4 years to 2 years, where you did effectively 2 years of learning in your own time. So that was quite a challenge, juggling working full time, doing my studying, and also trying to teach myself some of the modules that they didn't have time to teach us in the course. So that was quite a struggle, and it was quite a long slog. You're under a lot of pressure to get everything completed and finished before you can apply to do your final practical exams. But it was a massive relief when I actually managed to do it. Throughout your training, you have to work towards your nursing progress log, which is also known as the NPL, and basically it's a list of different skills and competencies that you have to prove you're capable of doing to a certain degree before you can be signed off on it. So basically you'll have the skill, so it might be restraining a patient for a blood sample. You'll have it demonstrated to you by your clinical coach, who's the person that kind of guides you through your training, or by another member of staff that's qualified. So they'll give you a demonstration, you'll then demonstrate it back to them, and then the skill is open, so then you can log as many cases as you feel you need to before you feel confident and competent doing it, and then you claim your competency. So then once you've kind of closed the skill, you demonstrate it to your clinical coach or to someone who is qualified to say, yeah, they're definitely capable of restraining a patient for a blood sample, for example, and then you're signed off on that skill. So you have a whole list of different composites, different groups that you have to work your way through in order to complete your NPL. So that runs kind of in the background whilst you're doing all your theory work throughout the 2 years. And once you've completed all of your NPL, you've passed all of your exams, you can then put yourself forward, apply to do your final practical exams, and that's the kind of final hurdle before the end is in sight and you can finally become a qualified nurse. Before I go any further into what being a veterinary nurse actually entails and what the job role is, it's just important to kind of point out that obviously I can speak with much more experience and confidence about going through the nursing training on a day release apprenticeship sort of path rather than the degree course. I'm sure for some people that's a fantastic way to learn, and ultimately you're still going to be as qualified, but for me it wasn't for me, so I can't really comment on it. But there are lots of universities in the country that offer the course, so if you wanted to get a combination of learning a vocation that you're passionate about whilst also having the uni experience, then it's definitely worth thinking about doing the degree. So I won't bore you too much with my history because it's probably not that interesting. I'm just one nurse in a whole ocean of other vet nurses in the UK, and it's really important also to note that once you're qualified as a veterinary nurse, you have got scope to travel across the world to all sorts of different establishments. You can volunteer at different sanctuaries, you can go and work abroad, you could go on Mission Rabies, for example, where they try and eliminate rabies in villages or towns or areas where it's rife, by vaccinating the animals that unfortunately are spreading it and suffering from it. So there's a whole host of things that you can do. It really does open up the world to you. So that's an amazing kind of opportunity that you could definitely consider once you qualify. So vet nursing as a job is incredibly broad. I mean, all jobs have so many different faces and factors and layers as to what you actually have to do day to day, and vet nursing is no different. I've just realised that I didn't actually include Rosie in the introductory video. That was her bum. She is a crazy working Cocker Spaniel who loves nothing more than charging around like a headless chicken on a walk. So I don't see a lot of her when we're out. She's very, very affectionate and well behaved at home, but yeah, she loves running around. So I try and call her back, I try and train her, but it doesn't always go that well, so I just let her do her thing. So as veterinary nurses, there is a massive expanse of skills and jobs and day-to-day roles that we have to carry out in order to help the practice run as smoothly as possible. That can range from being involved in anaesthetics to running nurse consults, to helping with the infection control of the practice, so making sure everywhere's nice and clean, to the animal husbandry, to looking after hospitalised or inpatients. The list is never ending. I don't want to go into it too much because I think it might be a little bit monotonous and boring, but I'll try and cover the most important aspects of the veterinary nurse's role in practice, just to give you a bit more of an understanding about it. So let's start out the front. A lot of practices will have receptionists, so the nurses don't necessarily have to do too much on reception, but if required, nurses will be expected to be receptionists as well, taking phone calls, making appointments, placing orders, doing stock takes, etc. They're also there really, and this is I guess one of the most important parts of the job, is to support the vet where they need them to, whether that's in theatre, making sure that the patient is anaesthetised enough during an anaesthetic for an operation, making sure that they've got all the equipment that they need, making sure that they've got the instruments that they need for a procedure, right back out to the consult room, so making sure that the consult room is well stocked, making sure that all of the needles and syringes are in date, making sure that there's sufficient supplies of everything, making sure that everywhere is nice and clean, making sure that everything works properly, and checking the dates on the injectable medications so that they are in date and safe to administer. But supporting the vets isn't the only role that we have. Nurses are becoming more and more independent and able to do more and use their qualifications and their skills a lot more as well. And one of the best ways to do this is the nurse clinics or nurse consults. So these are a fantastic tool for practices to use to encourage people through the door, but not necessarily use up the vet's consult slots. So nurses can see puppies and kittens for second vaccinations, they can implant microchips, they can give a whole host of advice on various things, whether that's worming and flea treatment, whether that's neutering, whether it's weight management, whether that's dental care, or even right down to kind of end of life discussions about euthanasia and working out the most suitable way for certain families to cope with the loss of a loved pet. As I've mentioned already, nurses will also be responsible for maintaining anaesthetics for procedures. So whilst a vet is performing an operation, whether that's something fairly routine like a neutering procedure, so castration or spaying, or whether it's emergency surgery, the nurse will be there to monitor the anaesthetic to make sure that the patient is sleepy enough that they aren't feeling anything, but they aren't necessarily too sleepy that they're going to take a long time to wake up. So there has to be an element of knowledge about pharmacology and different drugs used so that you understand how they affect the body and the central nervous system, and know what to look for. So another aspect is the lab work that's expected of a vet nurse. So that can range from taking blood samples to running the blood tests in-house, to packing samples up and sending them to an external lab, to looking at slides underneath a microscope, to adding results onto the patient's file. There's lots that can happen in a lab, and it's another expectation that the vet nurses will ensure that this runs smoothly. Ultimately, a smooth running lab will mean that we get more diagnoses in, and ultimately mean that more patients can be treated as effectively as possible. Another really important aspect of veterinary nursing is looking after inpatients or hospitalised patients. The easiest way to kind of wrap your head around what this means is if you imagine the role of a nurse in a hospital. So when patients require medication, they will ensure that the correct medication is being given at the correct dose and make sure that the patient takes it. With tableting animal patients, we can't ask them to show us that they've swallowed, so we have to make sure that they've definitely taken their tablets. It will also be making sure that drips are running properly, so the fluids that are being given intravenously are being given effectively, and there's no issues with that. It might also involve changing the bedding, so if a patient has an accident, we make sure that they quickly get cleaned up, new beddings put in, and they're nice and comfortable. For patients who are recumbent, which means they're not really able to move themselves around very much, we have to make sure that they're turned on a regular basis. This avoids the build-up of mucus in the lungs, which can cause lots of problems, and it also means that we avoid the risk of getting bed sores, which are also known as decubitus ulcers. Also known as decubitus ulcers. So these can build up if the weight is all on one side for a prolonged period of time and the patient hasn't been moved. They can be really uncomfortable and painful, so we need to make sure that we avoid those as much as possible. So along with these very important aspects of being a vet nurse, there are also some slightly more mundane aspects. For example, a lot of cleaning. Lots of cleaning is involved in a practice, and ultimately it does come down to the nursing team to make sure that the practice is nice and clean, nice and sterile in the places where it needs to be, and that everything is suitably packed up and cleaned effectively to maintain infection control. So whether that's washing, it could be cleaning kits and packing them. We use something called an autoclave, which basically sterilises kits or drapes or any instruments really that need to be sterilised using steam. I'm just going to stand still for this bit because I keep getting the sun in my eyes and I can't see what I'm doing. Thank you for watching today's video. I hope that it's been useful and given you a little bit more information and insight into what it is to be a vet nurse and what that job role entails. Here comes Rosie. I've really just skimmed the surface. I haven't gone into too much depth because I think that that could be quite a long and potentially boring video if I explored the role in all of its intricacies. So I thought I'd keep it short and sweet, especially for the first video. But thank you for watching and taking the time to watch all the way till the end. I'll be posting another video very soon about another aspect of vet nursing, so watch this space. If you've got any comments or queries or questions, then please do just get in touch using the box below. I'd be really interested to have any feedback, positive or negative, so please don't be shy, come and say hello and let me know what you think. Stay tuned for future videos and I'll see you guys really soon. Thanks again.